Hi, today I will be talking about drug adverse reactions on the oral cavity. It's about the side effect that several medication could have on the oral mucosa. First of all, I would like to emphasize the importance of taking comprehensive and detailed drug history from each patient we examine. Starting with xerostomia, which is actually a very common side effect of a very common medication. Radiation treatment for a cancer patient could cause hyposalivation, and that will cause the tongue to be in appearance like this: atrophy, red, shiny, with cobblestoning of the tongue. Dryness also could cause the food to be retained on the between teeth, and the lipstick, as you can see here, retained on the tooth. All of these are signs of xerostomia. As you know, severe xerostomia, like in radiation treatment, could cause candidiasis, root caries, and actually rampant caries. Medications that cause xerostomia are antidepressants, antihypertensives, antihistamines, anticholinergics, isotretinoin, that used to treat acne, narcotic pain medications. As you can see here, most of the medications that cause xerostomia start with the substrate anti. Some medications cause candidal infection in the oral cavity. A very common one is steroid inhaler that used for treatment of asthma. Systemic corticosteroid. The steroid drugs suppress the immunity and make the host susceptible for fungal infections. Broad-spectrum antibiotics also predispose to fungal infection. This is a case of pseudomembranous candidiasis evident on the tongue. It's differentiated from other white lesion by being able to wipe off, leaving an erythematous space. Here we can see a white and red lesion, candida lesion. This case must be a immunosuppressed patient, like cancer chemotherapy patient. Here we can see candidiasis from topical steroid therapy on the lateral border of the tongue. This is a candida infection from topical steroid inhaler or topical therapy. Some medications cause gingival overgrowth. All of us know this medication: phenytoin, cyclosporin, calcium channel blockers, certain contraceptive, could cause the gingiva to be like this, hypertrophied, enlarged, in this case induced by phenytoin. Here by phenytoin also, here we can see a cyclosporin induced gingival enlargement. Some medications cause mucositis, which is ulceration and crusting and bleeding of the oral mucosal membrane, especially in cancer patients who are on chemotherapy and radiotherapy. In this case, we can see ulcerative mucositis secondary to chemotherapy, here on the lower lip. Here we can see ulcerative mucositis all over the mucosa of the oral cavity. It's a very painful condition. A mucositis presents with widespread erosions in cancer therapy. Another side effect of medication in oral mucosa is aphthous-like ulceration. Chemotherapeutic agent could cause aphthous-like ulceration. Immunosuppressive agents could cause it. Non-steroidal anti-inflammatory drugs and phenytoin as well. Some antibiotics could induce aphthous-like ulceration. Here we can see a methotrexate-induced oral ulcer in the oropharynx. It's a very relatively large ulcer with irregular borders. Here we can see an oral ulceration due to low-dose methotrexate on the floor of the mouth with no induration. This is what differentiated from oral squamous cell carcinoma. Some medication cause tooth discoloration, so a brown or yellow-brown or gray tooth. The very famous one is tetracycline. Tetracycline, taken in the pre-eruptive period in children, could cause the grayish discoloration of the teeth. It's an intrinsic staining, while iron-containing medicaments could cause extrinsic staining that could be managed by polishing the teeth. Chlorhexidine, prolonged using of chlorhexidine could cause brownish discoloration as seen here in the cervical area of the lower anterior teeth. Some antibiotic that use it in intracanal medicament in endotreatment could cause a greenish discoloration, like medicament containing minocycline. Drugs like bisphosphonate and anti-resorptive agent like denosumab could cause osteonecrosis of the jawbone. As you know, it's very common in the mandibular area. This is a case of extraction in a patient taking denosumab, and following extraction, the bone left exposed for a very long period with no healing. This is an osteonecrosis. Here a case of patient receiving low-dose alendronic acid, which is a bisphosphonate agent. Here you can see the appearance on panoramic radiograph, massive radiolucency, bone sequestration. Here is the clinical appearance with necrosis, unhealing exposed bone. This is only after extraction of the upper left second premolar in a patient taking just a low dose of alendronic acid. Some drugs cause lichenoid drug reactions. As you know, lichenoid reaction is different from lichen planus, although they might have similar appearance. Lichenoid drug reaction is unilateral, while lichen planus is bilateral in most of the cases. Lichenoid drug reaction might be induced by anti-malaria's drug, by beta blockers or methyl dopa, hydrochlorothiazides, which are a hypertensive drug, anti-hypertension drug. Non-steroidal anti-inflammatory drug could cause lichenoid drug reactions. Sulfasalazine, sulfonylureas, all of these can induce lichenoid drug reaction. Here we can see a lichenoid reaction on the lateral border of the tongue induced by rituximab. Rituximab used for autoimmune diseases. Here, an interesting case of lichenoid drug reaction bilateral in patient taking anti-tubercular drugs. This is a case before and this is after. This is before and this is after stopping the drugs. It was bilateral and there is a complete resolution of the lichenoid reaction. Some drugs cause hyperpigmentation as a side effect. As you can see, this is a case of hyperpigmentation of hard palate induced by chloroquine therapy, showing a blue-gray pigmented diffuse lesion with irregular border. Some medication could cause erythema multiforme. This is a case of 23-year-old female patient reported to the dental clinic with extensive painful ulcers and hemorrhagic crust on the lips and difficulty in eating. She has a history of common cold 2 weeks ago. She took for that azithromycin and diclofenac sodium. Then she presented to the clinic with these signs and symptoms: irregular ulceration over the lower lip, irregular ulceration over right and left buccal mucosa, typical target lesion over the skin of the leg. You know this target lesion. Diagnosis of help and diagnosis of erythema multiforme. This is a classic target lesion over the sole of the foot and on the palmar surface of the hand as well. So you have to know that some medication could induce erythema multiforme, could be the cause, and could have the side effect as erythema multiforme. All of these was common side effect of medication that affect the oral mucosa. That's all what I have. Thank you.